when we speak about a typical healthcare landscape, we have a lot of moving parts, right? So we have various hospital facilities, we have million plus patients, and we have various specialties. And somebody was saying like the product takes care of general medicine and not other things. So we have various specialties, and we have different associates who are involved in various activities of the hospital and so on. And similarly, when you look at applications, we have applications, the core healthcare application, then we have our ERPs, we have other kind of applications that are used. So we have a number of applications doing various things right from when a patient registers for the initial appointment till the patient gets discharged in an IP scenario and all that. So a lot of applications are there, and then we have, yeah. So we do all that, and then we have different kinds of stakeholders who use these applications and all that. We have the patients who can probably book appointments on a mobile application, or we have doctors who can put the EMR, or we have nursing fraternity who use the application to kind of understand what treatment needs to be provided, and we have student doctors and all those kind of things. And when we look at the type of data that we collect a wide variety of data over the different stages of the patient journey. And when you look at it, it's humongous. And I think the previous speaker was talking about the terabytes of data that they hold over the last several years, right? So it's something which is very complex, and we also use different kinds of technologies. The data resides on the server, and then we have data that is managed through mobile applications and so on. So various things are there, and various tools, like somebody mentioned about WhatsApp, all those kind of things, yes. So the answer is there are a lot of challenges in terms of security, and also there are challenges in terms of privacy. And with the privacy law coming into place in India, most likely anytime soon, so we are going to be having more and more challenges in dealing with this. And the biggest thing that we need to do is in terms of creating the required awareness amongst various stakeholders. So I know the next speaker is going to be talking about privacy, so I wouldn't want to get too much into it. And so when we talk about data, we have data that we directly collect from the patient. Also, we have data that gets generated during the course of the treatment. And we have data that gets enriched through the monitoring processes, and then the analysis that happens and so on. Right? So these are kind of things. So the whole picture here is to say how complex it is. So if CMC has developed a solution over the last 20 years, I'm sure it's not easy. So it's been probably a big journey for CMC, and I'm sure any health information management system that has been developed is equally the same. In fact, in Narayana, we have a product called Atma, and we have built it in-house, ground up, and so it's not easy, and I know the kind of challenges that we have in building it secure, as well as ensuring that it's usable by all the stakeholders like the doctors, the nurses, patients, and so on, right? So it's not easy. So just coming to the basics of it, because I always like to talk about basics, because this is where many times we forget the basics and we start building castles in air. So why are we here? As a hospital, we are here to save the life of a patient. And for that, we have to provide appropriate medical care in a timely manner, right? And for us to do that, we need to have accurate medical information, and we need to have the patient's medical record. That's where the EMR comes into picture. And the medical record needs to be both historical record as well as the current record, and that's where somebody spoke about interoperability. So you have data in different systems earlier, so you try to get the data in a way where it's easy for the doctors to understand the history of the patient and provide appropriate medical care. And we also have to make sure that the system that is being used should be highly available. As and when it is required, the system should be up and running, which means a health information management system does not have the luxury of even a financial product. For example, a bank, you can see the portal says that there is a downtime of 4 hours or 5 hours, and we are going to be doing an upgrade and so on. But I don't think the hospital information management system team has that luxury to say that, okay, we are going to have a downtime of 4 hours, right? So whatever we do It's something where we have to be doing it as and when the work is going on in the hospital 24/7. So that's the additional challenge that the development teams face or the IT teams face in building an application or maintaining an application and having it available 24/7. And adding to this complexity, it's not just the IT systems, it's also the operational technology, the OT systems. A lot of medical devices are there, medical equipment are there. And each one has its own kind of security challenges. For example, if you look at the typical medical systems, some of them will be running on legacy software. So you will still see in any hospital, I can bet on my house saying, people still use Windows 7, Windows 8, and so on, even though Microsoft has stopped support for that, and even the endpoint protection may not be available for those kind of software. But unfortunately, we have invested crores of rupees in a particular equipment, and we are using that and hoping that things will get. And the vendors are not ready to upgrade them as much as we would like them to do, which means for security practitioners like me, it becomes an additional challenge because how are we going to protect the organization from an attack? And cybersecurity is something which is a ever-changing thing. So what we do today may not be sufficient. We have to do something more tomorrow, right? So that is the thing. So bottom line is, we can't afford to have a cyber attack because that will come in the way of our primary goal in terms of serving the patient. So we need to be ensuring whatever we do helps the organization to secure the systems in a way where patient data is available as and when required for us to provide the medical treatment. So this is something which I want to say from the Verizon Data Breach Investigation Report of 2022, because if you see in the last year, there are about 13 critical incidents that have happened across the globe. And I'm not going to name any hospital or any organization, but the whole thing is that different kinds of issues have been there across the globe, if you take US, UK, and all that. And the primary thing is, okay, denial of service is one of the most common things that have been there. It was slightly showing a downward trend somewhere in 2018 time, and again it has picked up, and it's one of the most common attack vectors. And then if you look at basic web application attacks, so that is where we start looking at when we build a web application, we need to make sure that security is baked in by design, and we try to make sure we do vulnerability assessments periodically and try to ensure that whatever vulnerabilities are there are closed. But having said that, there are a lot of moving parts in a software. So whatever you do, suddenly a vendor product would have introduced a bug, and that's where you need to be racing against time to address those issues. So you have to be very, very alert, keep a constant vigil, do periodic vulnerability assessments, and then ensure that you have stay on top of what are the vulnerabilities that are there, and then try to remediate them on time. So a robust vulnerability management program is something which will help you not only to identify the vulnerabilities that are there in the system, and also to make sure that they are remediated on time, so that you're probably at least one day ahead of the attacker. And moving on to the other part, this is in terms of pattern over time in terms of industry breaches. The previous one was about incidents, okay, the type of incidents that you saw. This is about breaches. So again, web application attacks is more or less common, and system intrusion through the backdoor that's available in different softwares and other interfaces that you use are the ones which are responsible for providing an easy entry to the attacker. And healthcare is one of the most targeted industries across the globe. And the last one is about privilege misuse. When we have systems, we have engineers, we have IT people. Some of them have elevated accesses, and we also need to make sure that they do not do anything which can end up compromising our system. So the actions of people who have higher privileges also need to be carefully done, and it also has to be monitored carefully. While we trust people, we also have to make sure we monitor their actions so that we do not end up having a challenge. So this is some facts that are there about the data breaches that we have come across globally. And this is from the IBM Security and Ponemon Institute study of 2022. So if you see some of these figures, 83% of the organizations that have had a breach has had the breach for more than once. So which means it's not a one-time breach. They probably have had more than one on more than one occasion. And 60% of the organization's breaches, which means it has increased the cost of their operations, which means they pass on that cost to the customers. And I don't think in healthcare we can afford to do that, because one of the things is healthcare is also a social sector. We try to serve the humanity by trying to provide affordable treatment. And I'm not going to read everything, but a few important things. When you look at the average time to identify and contain a data breach, the study shows that it has taken about 277 days. And if you look at any of the major breaches that have happened in any sector, not just healthcare, the attacker would have been there in your system for months together before even you become aware of it. So that's the biggest challenge. So we have to keep a constant eye on any activity that happens, and that's where things like our Security Operations Center and so on comes into picture, where we keep looking for any potential signals that are there, which tells us, okay, there is some unusual activity that's happening. And that's where things like AI and machine learning can help in terms of identifying any kind of pattern that is unusual and try to use those technologies to the benefit of identifying issues ahead of time and try to at least stop that from continuing further. Because once an attacker gets into your network, then they start doing a lateral movement. So how do they get into your system is to any of the weakest links. It could be an email link somebody would have clicked, maybe a nursing station somebody would have clicked, or a doctor or anyone, right? One of us would have done that mistake, and then say, let's say I do that, my system gets compromised, and from there it starts compromising the entire network. So that's the challenge that we have. And the last but not the least, the average cost of a breach in critical sector, which includes healthcare, is about $4.82 million. So which means it's better to put some preventive controls rather than paying it at the end of the day, which means we as security practitioners have to kind of keep talking to the management, engage them in a discussion, and try to kind of identify appropriate solutions that will help us. It's not just that, okay, we get carried away by what some vendor says. We have to do a lot of due diligence and understanding which solution fits our requirement, and then accordingly invest in that. And last but not the least, we need to have proper incident response teams, because the incident response process is what is going to help us to mitigate a risk. Let's say we have an incident, how soon we recover from that and then try to come out of it is what is going to help us to get back on track. So definitely, while we have all the technology and all that, we should also be ready with a business continuity plan, so that should in case we get into an issue, we are able to kind of get back to business as usual with maybe paper and written prescriptions and so on. And we have seen such cases across the world, right? Ambulance services have been disrupted. I'm not talking about any particular geography. Even in UK, we have seen this. So, and the last one, 12 consecutive years, the survey shows that the healthcare industry has the highest average cost of breach, which means we are an industry which is targeted more. We'll see why later. Okay, yeah, it's there. So if you see, the health data has a lot of value, and it's estimated that the health data, PHI, of a particular patient costs about $400 in the dark web. And I'm saying it can even go up to $1,000. So it's because it has a lot of data, it's sensitive personal data, it can reveal a lot of information to various stakeholders who are there, and people are ready to buy that data. And information availability is the key, because that's where we can provide the timely care. And in case we disclose data to a wrong person, then that's going to end up in a privacy confidentiality issue. And with privacy laws across the globe, it becomes the biggest privacy challenge as well. And last but not the least, any breach of data is also going to result in a reputation issue for that organization. And we deal with different kinds of data, so I'm not going to repeat that. And there are different interested parties who will be interested in the data. And there are also different links that are there in our system. For example, one of the biggest problem for any organization in security is the supply chain. So if we are going to evaluate a third party for providing any solution to us, we should also be critically evaluating their security aspects, whatever be the solution they are doing. Let it not be an EMR, let it be a solution which is used by a finance department or say a supply chain or whatever. We need to carefully analyze the software and try to understand their security practices. And in case, for example, any medical equipment requires some monitoring from outside and you want to open it up for the internet, try to understand what is required, why is it required to be done, and what is the kind of architecture behind how are we going to establish that connection, and make sure how secure we are so that we just open it up only for that particular need and we do not just give a blank check to someone else. So these are some of the challenges that we have, and I'm sure the security folks at CMC will be definitely aware of all these things, and it's something which is a nightmare because you'll have sleepless nights if something goes wrong, and you want to prevent that. And what is it that we can do in managing cybersecurity in a better way? Of course, various things. Governance becomes the most important pillar. And we need to ensure that whatever we do from a security standpoint or a privacy standpoint is aligned to the business. Because we cannot just be talking some theoretical thing, or I as a security practitioner say that, okay, I would like to have 1 crore of investment or something. The management is not going to be interested in that. We need to see how it's going to help the business and provide value for that. So that's one of the things. And then any policy that we write should be meaningful. Many times in my previous role as an auditor with one of the reputed certification bodies, I would have audited about 200 plus organizations across different sectors. One of the things I commonly see is people write some policy and procedure which appears fancy. It's of no use because what we are writing is not going to help us in any way. Write something which meets our business requirement, makes sense to the process that we are following, and does it help the organization in achieving its objective. So basically, whatever outcome we are looking at, whether that outcome is going to be achieved or not is what we are going to be looking at. And of course, risk management, and again, risk assessment is one of the most misused things in the industry. ISO 27001 calls for a good risk assessment based on the context of the organization. But if you look at it, most of it would be a copy-paste done by a consultant. All that they do is find and replace organization A with organization B and say, here is your risk assessment. Even if you identify 10 meaningful risks, if it is relevant to your organization and its context, that will add more value and you will be able to understand your risk better rather than just having a risk assessment for the sake of it. And of course, any risk which is higher, residual risk, for example, I as a security practitioner need something and I have identified a risk, but let's say we are not able to provide a budget for it, at least document the risk, get a residual risk sign off from the management so that the management is aware of it, and at an appropriate time when there is a budget being made available, when there is an opportunity for making it available, they'll definitely do so. And of course, program development, we have to be thorough with that. A business use case based approach is better. What works for business? Why are we doing something? And it will also help in prioritizing which is bigger over the 10 things that we may have on hand. And it's good to have a roadmap for about 18 to 24 months. And then the roadmap also includes the technology adoption that you want to plan. And try to use a technology that fits into your overall scheme of things so that you don't keep changing things every few years because it's going to be very expensive. And somebody was mentioning about the cost of acquiring a new technology. Yes, that's definitely one of the biggest challenges that we have. So we have to see how we can optimize it. A pay-per-use model is also definitely a good model that we should look at. Incident response we just spoke about. So we need to make sure that containment guidelines are there. And situation response manuals need to be made available so that we know what needs to be done should we run into a particular situation. And people need to be trained on that. Privacy by design and security by design, I think this is one of the most fundamental things. I think the industry is evolving, whether it is manufacturing, financial services, or healthcare, whatever may be. I think security is something which is getting improved. in terms of the design. And privacy by design is something where I think things have started taking shape after the GDPR was introduced. A lot of companies have paid attention to that, and I think now once the law is there in India also, privacy by design will definitely get more attention, and we need to do something to ensure that whatever we build, whether it's a process or a solution, we ensure that the privacy is baked in as part of the solution of the product that we build. Okay, so with that, I would like to end my presentation. And the most important thing is there is no security without you, which means all of us have to contribute to security. And it's not just the security team's job, because they can only do as much as they can. And somebody was talking about what if people use WhatsApp. And the answer is, as the organization has put in a policy, we can only put in policy and try to enforce it. But if people decide not to cooperate with that or start using something, then it becomes a challenge. So slowly we have to identify, work with the relevant stakeholders, identify what's going on. So one of the best ways to do is to walk around the hospital units and try to understand what's going on rather than just sitting in a desk and try to see what's going on. So one of the things we try to practice, we have about 18 odd units across the country. We try to visit them and understand, and we just go without this ID card sometimes and try to see whether we are able to walk in casually into an area, because they will not know who we are and are they allowing us inside. And if they allow us inside, then we try to educate them and say that, okay, why are we allowing us inside without checking the identity? So those kind of things become very important, because if somebody is able to breach your physical security, you never know what can go wrong, right? So those are the things that are there. So it's everybody's responsibility. With those few words, I think I will end my talk. If there are any questions, I'll be happy to answer.
Thank you, Suresh, for a very simplistic overview of an otherwise complex topic. We can probably take one or two questions and then break for lunch.
Thank you, sir, for a lucid overview of things. I just wish to add one more perspective to the ransomware attack and the data breach. You put the loss in terms of millions of dollars. But as a clinician, I understand that when the AIMS attack happened, for 3 days, the admissions are stopped or the billing is delayed. There are 10 surgeries which are scheduled, which is not happening. 10 patients who were supposed to come into that bed hasn't happened. So there is loss of life. We have not quantified that. So in my perspective, the government or the governance have to create punitive measures which should prevent this at the scale of a terrorist attack. And are we going in that direction?
Yeah, so to answer that, I didn't want to take any organization in particular, because there is a lot of context behind each organization. But to be talking about it in general, any organization, that's where the incident response plan and business continuity measures that I spoke about, we need to definitely have business continuity measures, and we at Narayana also have evolved business continuity plans. Should in case, let's say, forget about ransomware. Let's say due to some reason our internet connectivity goes down and we are not able to have our applications accessed, we have measures in place where we can still go on paper and pen and continue the work. So that has been planned, and it's been tested also in different units periodically. And maybe there is scope for improvement there, but definitely it is being done, and I'm sure other healthcare providers are also doing it. So any organization, irrespective of where we are, whether it's A, B, or C, whether they're in India, UK, or US, or whatever, I think everybody has the same challenge. So ransomware is one of the biggest threats, but whatever be it, any downtime that can be caused to our hospital operations, that's why I said, though the initial slide appeared to be very rudimentary, I still wanted to emphasize that, because we are here to save the lives of patients, so we can't afford to take a chance. So whatever parallel mechanisms we need to have, we need to create. And I think the industry is moving there, to answer your question shortly. But each organization has to reflect on it. And if we think we have to do something more, we have to do that.